Professional athletes are prone to ankle sprains, which typically occur after sudden stops and starts and twisting of the ankle. The pain due to these injuries can often cause professional athletes to watch from the sidelines as their body properly heals. Today we visit Dr. Rhonda Bosharon, sports medicine orthopedic surgeon and athletic trainer, to tell us more about ankle sprain injuries.
An ankle sprain is an injury to the ligaments of the ankle. Ligaments are soft tissue structures that connect bone to bone. An ankle sprain could be as insignificant as a minor irritation of the ligament, a minor stretch of the ligament, to a significant stretch or near rupture of the ligament. Usually the symptoms are pain, inflammation, swelling, and or as extensive as bruising and or inability to walk or load onto the foot or ankle, depending on how significant the sprain is.
Type 1 is a minor tear. Type 2 is a moderate tear. Type 3 can be a really severe tear. A lot of bleeding you'll see with that kind of accident, which means you get black and blue to the skin. A lot of swelling with that kind of sprain. Immediately, 72 hours, no heat. That will cause more problems if you put any form of heat on an ankle sprain than anything else. The first thing to do is your RICE, right? Rest, ice, compression, elevation, right? To get this tissue calmed down. If that dissipates, the pain dissipates and the swelling goes away, the exercises that you can do to help rehabilitate a minor ankle sprain and to prevent it from happening again, or at least reduce the incidence of it again, are balance exercises. What does that mean? Standing on an unstable surface with one leg and working on these quick reflexes. We have some excellent examples of those exercises. Stand on one leg. This is on a hard surface, no shoes, and you should be able to stand in that position without swaying for 20 seconds. Now we're going to do it with the eyes closed. So you're going to stand on one leg, get your balance, and close your eyes. By the way, you should do it on both legs. One with your eyes open, one with your eyes closed on a firm surface. And then Dave, pull that piece of foam over. Now this really brings in more difficulty because we're actually taking the sensors underneath the foot and we're kind of fooling them by being on a soft surface. So now you're more relying on your vision and your inner ear. Good, Dave. Now balance on that with your eyes open. And again, you should be able to balance for 20 seconds without swaying or doing those gyrations to keep you up. Last test is with your eyes closed. And this one you're probably going to see a lot of you guys and ladies out there going to fall over like Dave just did. The second area is the hip. We have to strengthen the hip. Direct correlation between hip weaknesses and ankle sprains. 2 exercises for that. One is to strengthen the external rotators. You'll see that on a video. And the other one is to strengthen the hip abductors. This is an easy exercise really to do. And he's going to be, again, 90-90. So the hip is at 90, the knee is at 90. And again, if you are really weak, you won't even be able to put a weight on the end of this ankle. But he's going to bring it down as low as he possibly can, and then he's going to come straight up, Chris, as high as you possibly can, right? You want to avoid trying to bend the knee because we don't want to get the hamstrings involved. We want the deep hip rotators. Find a weight that you can only do 6 or 8 reps with and 3 sets. Work up to 12 reps, 3 sets, or 15 max reps, 3 sets, and then drop back down to 6 or 8 and add more weight to continually stimulate that muscle to grow. The hip extensors and the hip abductors. And Chris is going to get both with this exercise. As you can see, he goes back into extension and then lifts his leg up. And then you just take a weight again, put it around your ankle, and he's going to slowly lower it down, right, to the count of 10, and then come on back up again. Again, you find a weight you can only do 6 or 8 times, a couple of sets. You work up to 12, 15 max reps, 3 sets. Then the muscle is strong enough that you can add more weight. Drop back down to 6 or 8 and add more weight and progress that way, constantly stimulating the muscle to grow. If that ligament has been torn more severely, you need to get to see a physician. You need to probably immobilize it for a while. Maybe you might even need surgery and then go back to rehab.
Keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with SportsMD.com. Remember, at SportsMD, health equals performance.